On March 4, 1984, an 18-year-old medical student named Libby Zion was admitted to New York Hospital with symptoms of high fever, mysterious jerky movements, so-called tremors, along with some flu-like symptoms. The patient Libby Zion soon undergoes examination by doctors, and doctors prescribe some of the medication to subside her symptoms. But when her vital signs were reached at 6 on the next morning, her temperature climbed to 107 degree Fahrenheit. Staff immediately tries to cool her, but soon she suffered an cardiac arrest and died. Despite extensive attempts at resuscitation, the doctors couldn't save her. That was a nightmare for the whole family as well as the doctors who wrote the medicine. Later, Libby's father, Sidney Zion, went public and began to refer his daughter's death as a murder. Was it a medicine prescribed the doctors caused Libby's death? Or was it a kind of medical malpractice or negligence? Or was it a planned murder? Let's explore in this video. Libby Zion was a first-year medical student at Binghamton Medical College, Vermont, located in United States. Libby Zion was at home with the fever that she has been ill for few days prior, but no symptoms more severe than a fever that has been present. On the night in question, Libby's fever was sharply rising and she was becoming agitated. Her parents tried to call Libby's pediatrician, but they were unsuccessful. As soon they later tried to call their own family doctor, Dr. Raymond Shepman, who advised them to take Libby to the emergency room. Libby and her parents arrived at the hospital at around 11:30 that night. A medical history was taken which showed that Libby had a history of depression and was taking an powerful antidepressant named Nardil since from many days. Many physicians attended to examine the condition of Libby's illness, but none were able to find the exact cause of illness except suspecting that it would be a viral syndrome. Libby's case was assigned to two of the doctors named Dr. Louis Winston, who was an intern, as well as Dr. Greg Stone, who was a second-year resident over there. Two physicians gets in contact with Libby's own family doctor, Dr. Raymond Sherman, and decides to hydrate and observe her. As Libby was supposed to be admitted, she was taken to a room present on the 5th floor of the hospital, though the doctor who was assigned to her, Dr. Louis Winston, was working on the 3rd floor of the hospital. Within not less than an hour, as soon as Libby got admitted, Libby has been getting increasingly agitated. She was writhing around her bed, very uncomfortable.
She was moving side to side in her bed. She was moving her arms up and down from side to side, her head from side to side.
Around 2:45 a.m., Libby's condition was explained to his doctors, where his father tells that every time she used to get agitated, they have put her on IV. Well, it does best to the Libby, then let's go with it, says the doctors. As they were leaving, Libby turned to his father and said in Yiddish, "Sleep well, Dad."
In Jewish, sleep well. And that's the last words I ever heard.
At this point of time, Libby started thrashing and removed her IV tube several times. Afraid that Libby might hurt herself, Dr. Stone advises Libby to be given with a dose of Demerol to stop her convulsion. And this was the first fatal mistake of that night. After ordering the medication to be administered, Dr. Stone left the hospital to go sleep. Once given the Demerol, Libby became more and more agitated, flailing around her bed and trying to remove her hospital gown for she was too hot. She nearly put her head in a plate glass window while she was thrashing in her bed. The nurses who were in charge of her were still concerned that she might hurt herself. So at around 4 am, they called Dr. Winston, who first instructed them to administer another sedative called haloperidol.
Did not call, but expected to continue to be informed.
When the haldol failed to calm her down, Dr. Winston, via call, orders them to physically restrain her. Libby was placed in posse restraints with her hands, feet and torso tied at the bedpost. And this was the second fatal mistake of that night. Despite having the high temperature at the time when she arrived at the hospital, Libby's temperature was not taken consistently during the course of her short stay. Around 6 am, nurses find that her temperature has approximately rise to 107 degree Fahrenheit. Whereas the other doctors present over there testified that sometimes her temperature turned to be around 110 degree Fahrenheit. Libby went to cardiac arrest despite many attempts to revive her. She was pronounced dead at approximately 7:30 am on March 5, 1984.
And I said, "Are you trying to tell me that Libby's dead?" She said yes.
Well, the tragedy doesn't end here. Sidney Zion, who was a prominent editor for New York Times, was outraged. He was very determined to find the exact cause of his daughter's death. Sidney Zion believed that her daughter's death was due to overwork of the doctors as well as lack of supervision by these young doctors. Sidney Zion wrote many articles and given many interviews detailing about the issues that might have caused her daughter's death.
18.
She was 18.
You took her to the hospital.
Right, in New York hospital where they massacred her.
suggested that she had cocaine or something?
But they put out an enormous lie that they try to blame it on the victim, as they often do. And based on that terrible thing, we try to do something positive.
The first was the drug that Libby was given, the Demerol, was known to have potential fatal interaction with her own antidepressant medication that she was taking, that was Nardal. When these two drugs mixed together, it caused increased level of serotonin in blood, leading to high blood pressure as well as increase in heart rate and high fever.
Foremost contraindicated concomitant with Nardal was Demerol. Contraindicated with Demerol may cause death.
Medication should not have been given.
Second was the Libby's restraints. Aside being inhumane, these strains made Libby's fever even worse that already Demerol had been made it was. She was wrapped under constraints in a particular place which caused increase in heat, ultimately leading to cardiac arrest. Another issue was lack of Libby's supervision at that night. The only attending physician, Dr. Sherman, was at home at that time. Instead, she was left in the hands of inexperienced doctors such as Dr. Winston. He was only 9 months out of medical school at that time. It was a clear-cut recipe for a disaster from the start. Another major issue was doctors working for long hours without any rest. New York Times editor Sidney Zion writes, "You don't need kindergarten to know that a resident working a 36-hour shift is under no condition to take any kind of judgment call. Forget about life and death." This is an interview of Dr. Michael Infantio, who has been cardiologist in his city of New York from past 30 years, and even he has witnessed the Libby's case, where he talked about the condition that has prevailed in medical sector during the time of when this case has taken place.
We were on call every third night, and sometimes in the emergency room we were on every other night. So you worked from 8 o'clock one morning until 5 o'clock the next evening. In the emergency room, you just worked for 24 hours straight.
This tragedy took place before the days of computerized pharmacy system existed. There were no software programs available for pharma chemists as well as physicians to check rare drug-drug interaction, something which is now done autonomously at every major hospitals and drugstores. What caused tragic death of Libby Zion was a rare drug-drug interaction between Narvil, which she has been taking due to depression, as well as Demerol, which was given by Dr. Winston as she has been admitted to hospital. This drug interaction was almost unknown to all doctors at the time, regardless of their level of experience and exposure. From the intern to the resident to the attending doctors, no one were aware of this rare drug-drug interaction. But today, several years later, many physicians concluded that that was due to deadly combination of Nardil as well as Demerol, which was given to her, leading to serotonin syndrome. Symptoms might vary from mild like having tremors, agitation, to severe like having high body temperature, rapid heart rate, and even if not handled might cause cardiac arrest, as it has occurred in case of Libby. Libby's death soon made headlines all across the country, as the people wanted to know who should be held accountable for Libby's death. Despite the national attention, Sydney wanted it more. He persisted. District Attorney's Office of New York charged against the hospital and the doctors who treated her. Charges were brought in front of grand jury at 1986. But the grand jury didn't return an indictment. But they did agree that some structural changes had to be made to the system. In order to stop further tragedies like this happening in the future, they give 5 recommendations. Number 1. All level 1 hospitals should be staffed with physicians who have at least 3 years of practice and are trained for medical emergencies. Number 2. Interns and junior residents should be supervised in person by those who has experience in medical field at least of 3 years. Number 3. Department of Health should set up certain rules for the working hours of interns as well as residents along with hospitals. Number 4. Legislation should be enacted to say when a patient should be physically restrained and to standardize their care while in restraint. Number 5. The Department of Health should implement an computerized system to check rare drug-drug interaction. A study showed that 80% of the Americans who recovered from certain disease would want to see a different doctor if they knew that the doctor treated them has been working more than 24 consecutive hours. Looking all this ill condition in the system, New York State Department of Health Code under Section 405 introduced a new law called Libby Zion's Law, which stated that doctors in training working no more than 8 hours a week and no more than 24 hours in a row. Well, this is about the case file 1 and hope you guys liked it, and please make sure that you subscribe to this channel so that I will come up with more such content, and do comment for the case file 2. Well, this is another day presently first year medical student at Gym School Gurga signing off. Till then, take care.